The menstrual cycle is a natural biological process that women experience from puberty until menopause. It involves a series of hormonal changes that prepare the body for a potential pregnancy each month. Understanding your cycle is crucial, especially when using natural family planning as a method of birth control. The first day of your period marks the beginning of your cycle. The menstrual cycle can be divided into two main phases, the follicular phase and the luteal phase. The follicular phase starts on the first day of your period and lasts until ovulation. During this phase, the hormone estrogen rises, leading to the development of an egg in the ovaries and the thickening of the uterine lining. Ovulation is the process where a mature egg is released from the ovary, signifying the most fertile time of your cycle. After ovulation, the luteal phase begins, lasting about 12 to 16 days. During this phase, the hormone progesterone rises, preparing the uterine lining for a possible pregnancy. If fertilization doesn't occur, hormone levels drop, and the uterine lining sheds, resulting in menstruation. This marks the end of one cycle and the beginning of another. Charting your menstrual cycle is the cornerstone of natural family planning. By diligently recording specific signs and symptoms throughout your cycle, you gain valuable insights into your body's unique patterns and can identify your fertile window. This information is essential for effectively using the rhythm method for family planning. To chart your cycle effectively, you'll need to track several key indicators. These include the length of your cycle, basal body temperature, and cervical mucus changes. Start by marking the first day of your period on a calendar or using a dedicated fertility charting app. Basal body temperature, or BBT, is your lowest body temperature at rest. Your BBT slightly rises after ovulation due to increased progesterone levels. To track your BBT, use a BBT thermometer and take your temperature every morning before getting out of bed. Record the readings on your chart. Cervical mucus, produced by the cervix, changes in consistency throughout your cycle. As ovulation approaches, it becomes more abundant, clear, slippery, and stretchy, resembling raw egg whites. This change indicates peak fertility. Note the changes in your cervical mucus on your chart. Identifying your fertile window is crucial for successfully practicing natural family planning. This window represents the days in your cycle when you are most likely to conceive. Understanding your fertile window empowers you to either plan or prevent pregnancy. The fertile window is determined by the lifespan of both the sperm and the egg. Sperm can survive inside a woman's body for up to 5 days, while an egg can be fertilized for only about 12 to 24 hours after ovulation. Therefore, your fertile window spans approximately 6 days, including the 5 days leading up to ovulation and the day of ovulation itself. During this time, unprotected intercourse can lead to pregnancy. Recognizing the signs of ovulation is key to pinpointing your fertile window. Apart from the basal body temperature rise and cervical mucus changes mentioned earlier, other signs include increased libido, breast tenderness, abdominal bloating, and a slight pain or twinge on one side of the lower abdomen called Mittelschmerz. Calculating safe days, a step-by-step guide. Calculating your safe days using the rhythm method involves tracking your menstrual cycle for several months to identify patterns and predict your fertile window. Remember that this method requires meticulous tracking and may not be suitable for everyone. Step 1. Track your cycles. Record the first day of your period for at least 6 consecutive cycles. Note the length of each cycle, which is the number of days from the first day of one period to the first day of the next. Step 2. Identify your shortest cycle. Among the cycles you've tracked, determine the shortest one. This information is crucial for calculating the beginning of your fertile window. Step 3. Calculate the start of your fertile window. Subtract 18 days from the length of your shortest cycle. For example, if your shortest cycle is 26 days, subtract 18. 26 minus 18 equals 8. Mark the 8th day of your cycle as the potential start of your fertile window. Step 4. Identify your longest cycle. Determine the longest cycle among the ones you've tracked. This information helps determine the end of your fertile window. Step 5. Calculate the end of your fertile window. Subtract 11 days from the length of your longest cycle. For example, if your longest cycle is 30 days, subtract 11. 30 minus 11 equals 19. Mark the 19th day of your cycle as the potential end of your fertile window. The rhythm method benefits and limitations. The rhythm method, while a natural approach to family planning, has its benefits and limitations. Understanding these is essential for making informed decisions about your reproductive health. One of the main advantages of the rhythm method is its natural approach. It doesn't involve any hormones or artificial devices, making it appealing to women who prefer to avoid these methods. Additionally, it promotes greater awareness of one's body and menstrual cycle, leading to a deeper understanding of fertility. However, it's crucial to acknowledge the limitations of this method. The rhythm method heavily relies on consistent and accurate cycle tracking. Irregular cycles, stress, illness, travel, and other factors can affect cycle length and ovulation, making predictions less reliable. Compared to other forms of contraception, the rhythm method has a relatively lower effectiveness rate. It's essential to consider this, especially if pregnancy would pose significant health risks or is highly undesirable. Consulting your healthcare provider. While understanding natural family planning and the rhythm method can be empowering, consulting your healthcare provider is crucial before relying solely on this method for contraception. They can provide personalized guidance based on your medical history, individual circumstances, and reproductive goals. Your healthcare provider can help you determine if the rhythm method is appropriate for you based on the regularity of your cycles, your overall health, and your partner's commitment to the method. They can also guide you in accurately tracking your cycle and identifying your fertile window. Remember, open communication with your healthcare provider is vital throughout your reproductive journey. If you experience any irregularities in your cycle or have concerns about the rhythm method's effectiveness, don't hesitate to reach out to your healthcare provider for guidance and support. They can help you explore other contraceptive options that may be more suitable for your individual needs and preferences, ensuring you have access to the best possible care for your reproductive health.